Hi, this is Dr. Neurosurgery Greenberg, and we are continuing with our evaluation of the patient with the pituitary adenoma. So you are going to look at the thyroid axis now, and the first thing that we need to understand is that a hypothalamus releases TRH, which causes the release of thyroid stimulating hormone from the pituitary, and this causes release of thyroxine. So the first thing to do is to measure the levels of T3, T4, and TSH. T3 and T4 are the thyroxines, and TSH is our pituitary hormone. So what happens is that you have to remember the values, okay? Like TSH value, normal value is up to 5.5, 0.5 to 5.5. And unit per millicenti unit per ml, and the uh, the T3 and T4. So the free T4 is 0.8 to 1.5, okay, and the total T4 is 4 to 12. So overall, we just look at the TSH and the T4, and these are the normal values. So first of all, you find out whether these values are high or low. Now you will check the TRH stimulation test. If the patient is hypothyroid, means the thyroxine level is low. Free T4 is less than 1.5 or more, less than 1.5. And if it is, its total T4 is less than 4. Okay. So now about it is just borderline. Then you have to check what is the reason. Is the thyroid not making enough thyroxine, or is there some central cause? So you give TRH. In a normal person, you first of all check the baseline TSH, then you give TRH, and then you check what is the level of the TSH. The normal response is that the TSH will peak twice the baseline level. And but if the TSH is not able to peak, then it means that the problem lies within the center, the pituitary. But if the TSH is exaggerated, means it is very, very, very high, then it means that the problem lies within the thyroid, that it is unable to secrete any thyroxine for use by the body. Then we come to the prolactin levels. So prolactin levels are, first of all, their control. Dopamine is a prolactin inhibiting factor which is released by the hypothalamus. Because it is already being produced, so its mechanism is negative feedback. And under the inhibitory control, the prolactin level lies somewhere in between the normal values. I will share. So the normal values are around 3 to 30 for a nanogram per ml for a non-pregnant female. In pregnancy, it can raise up to 400, and in the postmenopausal female, it goes down to 22 to 20. Now, if the prolactin value is between 225 to 150, then it shows a moderate elevation. Now, there are two causes of elevation. The first cause is going to be that there is a real prolactinoma or a prolactin secreting a tumor within the pituitary. Here, the values will be more than 150 nanogram per ml. And the second cause is that actually there is another tumor. It can be any pituitary tumor, it can be any cellular tumor, it can be a craniopharyngioma, whatsoever it is so big that it is compressing the stalk of the pituitary, and the inhibitory chemicals coming from the dopamine coming from the hypothalamus is not allowed to reach the pituitary, and so the prolactin is only slightly elevated. So how will you tell that the pituitary tumor is there, or it is some other tumor that is compressing the stalk of the pituitary, and that is why the inhibitory effect is going on? For that, you have to look at the rule of thumb. you take the prolactin level, you divide it by 2, and you get the percentage. Let's suppose the value comes out to be 150. So the 150 divided by 2 is 75%. Now this 75% means that it is 75% chance that the raised prolactin is actually from prolactinoma, 25% chance that it is stalk effect. If it is 100, then 50% chance of prolactinoma, 50% chance of stalk effect. If it is 200, then it becomes 100% due to prolactinoma. So that is why any elevation more than 150 is considered to be prolactin is raised due to prolactinoma. Then there is another thing called hook effect. In hook effect, what happens is that uh, there are a very big prolactinoma is there, and it is secreting large amounts of prolactin. Sometimes you see that the lab tells you, okay, the prolactin level is more than 1,000. It is more than 1,100. It is more than 500. So what does it mean? It means that the machine is incapable of counting the prolactin molecules more than this level, like 1,000 or 500. So you have to get an exact value. Why is the exact value important? Because that is how you tell the patient that, okay, if the value is less than 500, the chances of correcting it with medication alone are pretty high. But if it is more than 500, then you have to tell the patient that you will have to undergo surgery. And number two, you will have to use medication for some time even after the surgery. And medication alone is not going to cure this raised prolactin. So you have to get the exact value. Now you call the lab, you tell the lab to dilute the blood sample. And after progressive dilution, there will be a point that the lab machine is going to be able to read how much prolactin there is. Then they will make some correction for it. And then they will give you the exact value of the prolactin levels. And you also, when you are following the patient with medicine, you have to know the exact value. So that this is called hook effect. And in this, you can even get a falsely low prolactin level as well. Like what happens is that the machine is unable to read it, and there is a huge prolactin noma in the MRI, and the machine is giving you only low levels. So that is why you must always ask the lab to do multiple dilution and then give you the exact value of prolactin if there is a huge prolactinoma on the MRI but very little prolactin. Okay. And then lastly, there is another concept called macroprolactinemia, in which the prolactin level are raised. But what they do is that they form chains, and very little part of the prolactin is active, and there are little to no sign symptoms. In this, the lab is going to give you a huge value, but the patient will be fine. So you have to look at the patient as well as the value, and then you have to correlate clinically. So that is all for today. I will see you in the next video. I actually forgot to do the thyroid stimulating thing, the thyroid axis. I forgot to do that. I will do that in the next video. Till then, thank you and God bless.